Thank you, everybody, for making time for today's webinar. The primary objective is simple. It's just to go pretty much through an in-depth review of the parameters that you can use for all 5 OmniFlow activities to kind of tailor the treatment session to your patient's specific needs. So to kick things off, we definitely want to review a little bit of the changes that are going to naturally happen with the pulmonary system when we age. Not to be doom and gloom to start off, but things like, your lung tissue, it's going to become stiffer with time, and you're going to lose some of that elastic recoil that you had back in your 20s, right? You might have some postural changes like kyphosis, forward head, some rounded shoulders. Respiratory muscles can weaken no different than the peripheral muscles, like you'll get with sarcopenia. So you can see the list. I won't go on in depth, but basically what we're trying to communicate is that with a normal aging process, you're going to see that the body has more and more difficulty to perfuse and ventilate itself. And this can lead to some drastic things. Like if you look at that last bolded statement there, the vital capacity of an average 65-year-old is about 77% that of a 25-year-old. So pretty crazy and not doom and gloom. There's a lot that can be done. And one of the best things is breathing exercises. Now, there's a large body of clinical evidence that supports breathing exercises for a number of pulmonary applications. So, just think about that normal changes of the pulmonary system as we age. Well, now put respiratory disease on top of that. That can be a problem, right? So one of the best strategies you can use is pulmonary exercises, and look at the things that pulmonary exercises can help, like dyspnea, hyperinflation, problems with muscle weakness and airway clearance, maybe dysphagia, people who have a really hyper autonomic nervous system and with dysregulation. Breathing exercises can help all of that and more. Now, when you look at OmniFlow, we have about 5 activities that you can choose from. And I want you to think of this as like your quick reference, concise snapshot of what those activities are and who they can benefit. Now, I'm going to go over each of these with a fine-tooth comb, but you might want to pin this one for future reference in case you need a quick snapshot of what the exercises are and what they do. And we have some awesome collaterals too that have been developed that I'll share with you at the end of the presentation as well. So the first one to kick things off with is Diamond Mind. Now, I don't mean to scare anybody, but Diamond Mind is the most involved of all the 5 activities. So the parameters might seem a little bit overwhelming at first, but the more you get your toe in that water, the easier and easier it gets to be to understand and apply. And the other activities are nowhere near as involved. Now, why might this be the one that's the most involved? Well, I want you to think of Diamond Mind as one of these on steroids, okay? Anything and everything that you could want to do with this device is being duplicated in a virtual format here. So whereas some of us might just understand, okay, I give this to a patient, they inhale and they inhale a certain volume of air, maybe accounting for flow. That's how this device is used. You can think of that as with what you're seeing right here. The patient visualizes themselves as a vacuum. They do that same inspiratory breath, and they'll collect things like coins and jewels. And of course, that biggest diamond, which is the end of the flow that you gave them based off their assessment. Basic translation, right? You have a $8 piece of plastic that can do it here. You have a virtual, more exciting, fun environment that does it with Diamond Mind. So before I show you the nuts and bolts of how to adjust the parameters, here's that same kind of reference that I was telling you about before. Why might you use Diamond Mind? It could really be the workhorse of what you do with OmniFlow. It's really applicable to most, if not all, but the patients you want to really zero in on are the patients with restrictive lung disease, right? These are people who have a hard time getting air in. So COVID, post-COVID definitely fits the bill. Any pneumonia, cardiac issues, people with just core weakness, right? Like the diaphragm is the top of your core. The indications really go on, but you're going to want to be aiming this exercise towards people who have reduced inspiratory muscle strength, long volumes, and bad SATs. So again, this exercise, you're thinking diaphragm being facilitated and perhaps the external intercostals, but it can very well be for patients who also need to use secondary muscles to breathe, like in case of COPD. So lots of goals there. What I wanted to show you guys right now, want to give you rather, is a couple of tips and then show you how to adjust the parameters, okay? So one of the tips that's kind of interesting is that your heart rate will temporarily increase during inspiration, but there will be a post-exercise effect once this has been done right that will cue parasympathetic activity and actually cause that heart rate to go back down. So don't be scared about that. it is always best to have this activity done with your patient upright. So try to refrain from the patient being completely supine if you can. Maybe elevate that head of the bed at least 30 degrees. That little bit will let gravity assist the diaphragm and help it work a little bit better. So upright, good posture, legs not crossed, always good tips for helping. And you're going to see a lot of parameters, like I told you. If you have anybody in your caseload that has some type of mild cognitive impairment, dementia, that type of thing, you might want to start and only use the volume only mode. So I'll show you what that means. I'm going to stop my share now and go over to the actual OmniFlow tool. And I apologize if you haven't seen this before. I don't have time in this presentation to break down how Flow works and how you set it up and how you clean it. But a couple of quick tips, just as a reminder, in case you do have the unit in front of you and you have been acclimated to this. Always helps to have a pair of gloves on at all times when you're doing this, both for you and for the patient, of course. When you're using the breathing device, even when it's in an enclosed system like this, you can have some particulates that you encounter. Some patients are going to need a nose plug. Meaning like on top to be consistent with what you're asking them to do so they don't cheat. So keep that in mind, have that handy. And then finally, having some type of collection cup. I'm a big fan of what I call the Robitussin cups, right? The cough syrup cups. It usually have mLs figured out. And if you do something like airway clearance, patient is going to need something to get rid of that sputum. I find it works best just to take a standard cloth, keep that little cup in your hand, and then they can do a cough. And you keep things as clean and as neat as possible. Not always fun to say and experience, but you definitely want to report to the clinical team what sputum looks like, how much. All of that can be relevant info. So moving on to Diamond Mind now, that's where we're going to start, and we're already in the system. What I'm trying to do now is select Diamond Mind and show you about some of the presets and some of the parameters. Now I'll keep moving this back so you get a little better view. There we go. You'll notice that there are a lot of preset parameters for you, such as easy, moderate, hard. That's our attempt at saying, hey, if you need to get started quick, go for it. Use one of those. What we would really prefer is that you do the assessment with Flow, figure out the capacity that your patient has, and then tailor it to them. So easy, moderate, hard may benefit them, but it may not. And what do I mean by that? Well, think of the overall volume that they're taking in. Level 7, level 10, level 10, like you're seeing for the easy, moderate, and hard, it may be appropriate, it may not be. So what you can do is go under Customize, and that's where all the parameters can be found. And I'll zoom in on this a little bit more so it's a little clearer for you. But this is really the nuts and bolts of what I wanted to discuss with you today for each activity. And if you play with this a little bit, a lot of it is very intuitive. So if you're a little overwhelmed by this at first, rest assured that the more you practice with it hands-on, you'll be able to self-teach. But notice the first thing is starting off with regular mode or time mode. Most people are going to want to go with regular. And I think a lot of that is because it's just easier. We're really looking for one set of 10 with breathing, maybe 2 sets of 10. This isn't anything more involved. The time mode can help you with certain conditions, but I would suggest starting with regular first to get moving. And notice that reps, sets, time between reps, these are all things that you can tailor as needed to your patient, no different than what you would do with a TheraX script. Okay, so obviously the more reps and sets you ask your patient to do with the less time in between, that would be adjusting the parameters toward harder, and then going the opposite would be making the activity easier. You're going to see that trend throughout all 5 OmniFlow activities. But the big one I want to kind of communicate to you is towards the bottom here, this target volume and exercise mode. You might recall me saying that the volume only mode, which I have highlighted right here, that is the best place not only to start with your patients with this activity, but probably also to leave it there for certain patients, such as those with dementia. So you see the target volume, and you might remember me referencing before that the presets of 10 or 7, it may or may not fit your patient. It certainly doesn't fit it for me. If I were to do this activity at level 7, I would barely have to inhale before I successfully completed the activity. So what I want to show you here is if I was your patient, you would know right off the bat, well, Anthony did an assessment. He was around 20, 24 for the volume of air that he could, do. Why don't I adjust this parameter up then somewhere around there so that this is a more appropriately tailored exercise for his ability? So that is the crux of what we're trying to do. I'm going to confirm that right now. Love these touch screens. And you'll notice that all those parameters, as I zoom out here, all those parameters are locked and loaded on the right-hand side of your screen. If you need to edit them again before you continue, you can, but we would just go ahead and start the exercise and prepare our sensor. And as we prepare our sensor, this is where we're making sure that our patient's posture is appropriate. We're getting all the supplies that we may need if something does or doesn't happen with this activity, such as sputum, right? We're making sure that our spirometer is set up the way we need it to be. Now you can see how the activity is set up, volume only mode. This is the easiest way to do this activity. And all the patient is trying to do is take a breath in and meet the volume, which I think I put it at 20 or 21 to complete the task. So for me to do this appropriately, it would look as so. All right. And that was tough, guys. I almost didn't get that diamond. I'm not going to lie. So that's what we're looking for, where I actually got, I struggled a little bit. That was hard for me. That's what we're trying to do with this type of activity. So let me back out, hit escape here. And again, I love the data that OmniFlow allows you. You're going to see a bar graph representation of the volume that was accommodated. And for me, it was 19 there. There's also loops. If you go on the left-hand side, you can see the loop for the inhalation for every activity that I did. So this really helps you understand not only like, was this exercise appropriate, but did it help make progress for my patient? Okay. So again, quick review. I'm just going to go back to the parameters. If that volume, I had it set at 21. If that was too hard for me, I would just simply move that down, or I could move it higher if it wasn't hard enough, right? The other idea is within that set volume, you can adjust your sets and reps as needed. And most RTs that are worth their salt are going to tell you aim for a good set of about 10 breaths of any activity per waking hour. So that's what I want you to keep in your mind. When you're just getting started, try to think in your head, one set of 10 or two sets of 5, build from that. Okay. And then we can get to more evidence-based loads as needed. So let me show you the next step, not volume only mode, but the exceed the minimum threshold mode, right? What are we trying to do there? And you can see that it's set up from 0.4 and it goes all the way up to, it doesn't seem very high, to just 1, right? Well, what are we trying to show you with this? I'm going to bring this probably somewhere in the middle here. I'm going to hit confirm and I'm going to let you get a visual on what's happening. Now we call this diamond cave rather. I'm gonna hit prepare. I don't know if you that study cave science out there, but you'll know that there's rock formations at the top of a cave and at the bottom. And at the top, they're called stalactite. Okay, but you didn't think you were going to learn this in a course with me today. But a stalactite, think of that letter T because it means top, or they hold tight to the top of the mind, right? You'll notice that that stalactite was popping out of the ceiling because you selected the next mode, not volume only, but where you want the patient to generate a proper pressure first, meet a minimum before they can start successfully doing the activity. So notice it doesn't really matter how hard I breathe in. I just need to breathe in a minimum amount before I start to collect the coins and meet the volume that I have programmed. So notice what this looks like. If I give a very weak effort first, see, I'm not generating enough pressure in that effort to get past the minimum inspiratory setting that I have it at, which is around 1. 1 is the highest, by the way, for that, which means that I didn't get everything that I needed for the volume. Okay, so part of this is helping the patient understand not just volume, like how much air did you get in, but also can you control the flow? We want it steady and easy over time. And that's very purposeful to allow the patient to reduce or prevent atelectasis, to maximize their ventilation. So you would want to encourage them for the next set, please breathe harder and then keep it steady so you can collect all the coins. And this is what it would look like. And you'll notice I was a little bit more successful, but I didn't get them all, okay? One other thing that I want to show you is that if I power air in, if I go as strong as I can, that vacuum is going to go down towards the ground, but still collect the jewels and gems. And let me first demo it, and then I'll explain it to you. This is what that would look like. Right? Whew. Okay, a little lightheaded there, right? Oh, I didn't get them all. You can see I just missed the end of that diamond, right? Now, that did allow me to meet the volume, and I did meet the minimum inspiratory pressure. However, blasting air in like that is not the purpose of what you would want to have happen with any spirometer use. Let me just get out of here for a second. And just to kind of show you what I mean, when you look at this spirometer, if you can see my little thumbnail there, that little gauge on this side, let me see if I can bring this in, maybe it'll be a little bit easier there. Okay, this yellow gauge right here, like the little plunger, you'll notice it often says, I can move this out of the way, good, better, and best. Maybe I give it a little, there you go, right there. Why is that on this incentive spirometer? Well, the idea is we don't want you to just power air in like I did on that last effort. It would look like this, right? That plunger went all the way up at the top. You would want to educate your patient, don't overly ventilate like that because you can prevent the proper expansion of all the alveoli that we want. So slow and steady is what wins the race here. And we want to duplicate that with the VR. The best way to do it, meaning with OmniFlow's virtual reality, the best way to do it and the hardest way to do it, I'm going to go back to the OmniFlow presentation here. If I go back and take you to the edit parameters, notice that we did volume only. We just did exceed minimal threshold with that stalactite. Now we have control flow. And control flow means it's not just that you have to overcome the minimum, for the stalactite at the top. We're also going to build a stalagmite on the ground, which think of that G as ground, right? So stalactite top, stalagmite, G, ground, I don't know, whatever helps your mind. But you're now setting that to prevent the patient from overly being powerful with drawing air in. It helps keep the cadence that you want for flow. So what I'm going to do is keep my minimal inspiratory threshold, the first one that I showed you, the stalactite, if you will, at about halfway. And I'm going to do the same for that stalagmite on the bottom. Okay. And you're going to notice that as I hit start and I prepare my sensor, again, I'm educating my patient. I'm kind of explaining them what to, expect, making sure everything's all set. And I have my collection tools if needed. They're going to see the stalactite develop from the top and the bottom. And that prevents them from going to the bottom with too powerful a breath. Okay. So what I want you guys to think is this is the goal. This is really where you want to get any of your patients that you're doing Diamond Mine with, if possible. Okay. And it's pretty tricky. I don't think I adjusted the volume. So this is still set at level 21, which is a challenge for me, but let's see if I can do this without breaking the rules here. Okay. Oh, it's hard. See, I went too high. Let me try again. Oh man, I'm doing it wrong. I'll try again. It might be, see, this is exactly what I want you guys to see because I have to adjust my settings. Let me show you what I mean. Because I couldn't get the task done, rather than make me stick it out, just X out, and I just use the escape button, go back and hit edit parameters. And you'll notice that I wasn't quite getting the volume. The volume was a bit of a challenge for me at level 20. I can drop that a little bit, okay? And then that stalactite at the top didn't really seem to be a problem, but the one on the bottom did. And if you want to make that easier, just move it over to the left. And I'll show you what I mean by that as a final reference next. But notice that as I adjust that and I hit start, you're going to see that the stalactite is about the same length with what I picked, maybe a little less. In height, if you will, and the bottom one, the stalagmite, is going to be way shorter, giving me a bigger field to appropriately draw in the coins and the gems and the jewels. So that's what we're looking for. Notice that you can barely see that stalagmite, if you will, if I'm pronouncing this right, on the bottom, because I adjusted that parameter, but I still have to overcome that general minimal inspiratory pressure as I set before. So let me go ahead and take a breath in for this. So notice I adjusted the parameters. It wasn't pretty, but it was a good breath for me. So this is what would be appropriate for me to start with. And as I get stronger and better with this device, we can start raising that stalagmite up, making it a more appropriate exercise for progression. Okay. So that's the nuts and bolts of what I wanted to show. But let me give you one more tip. Some people get confused when they look at what's that 0.4 to 1 for the top? Why is it 0.4 to 1? And then what's that 6 and 2? Those are the presets that we give you, the options, I mean, for making it difficult. Well, a little guide that I want you to reference is this, okay? So if you think about the stalactite on top, 0 to 1 makes the exercise harder, and it's technically 0.4 to 1. On the bottom, that stalagmite, 2 to 6 is what I want you to think of from the top of the screen down. But as you get closer to 2, it's harder because the stalagmite is taller. And then vice versa. 6 is easier, which is pretty much where this activity is set at here. It gets a little confusing, but when you use it a couple of times, it's very intuitive. You'll understand what I mean by all this. But just to do a final recap. Notice that there's minimal inspiratory flow threshold and maximal inspiratory threshold. Think of that as stalactite on the top, stalagmite on the bottom. And you can see anything towards the left is going to be easier. It just gets confusing for the maximum inspiratory flow threshold, because all the way to the left is a higher number than all the way to the right. And that's why I think that little picture that I showed you might help you understand why it's harder, okay, even though the numbers are going down. So going back, I'm going to take you to the slides again for a second. Here we go. And just to kind of, again, take you through how, let me go back to slide presentation, just so you can kind of understand how this presentation that's should have been sent to you is sped up. We will go through all of these specifics with you. So you can see some nice slides that point out everything that I was telling you about with the sets and reps, the target volume, what volume only versus the next step of exceed minimal threshold, and the final step of controlling flow, what that's all about. And if you need a little bit more clarification on what minimum threshold is and control flow, which is minimum threshold for inspiration and maximum, it does a really good job showing all that. Now, finally, we have a really good one-page reference that I just want to show you since we went through all of this. This should also have been provided to you. This is really nice. We have a 1 to 2 page summary for each of the activities that I'm going to review with you. We just did Diamond Mind, and you'll notice that whether it's the diagnosis, what the exercise goal might be, what the general tips are that I reviewed with you, it's all covered right here. It does a really nice job of reminding you of volume only, exceeding minimal threshold, and controlling both for flow. And this is what I absolutely love. Not only is it beautiful in presentation, but it does a great job. Anything in that kind of light blue color is an option for decreasing the challenge if you need to for your patient. Anything in green is going to show you what you can do to increase the challenge. Okay, so it could be as simple as just reducing the time or between sets, or how many sets and reps you do, or increasing it, as we mentioned earlier. But if you want to talk about minimal threshold or minimal and maximal threshold, it's all outlined for you there. And that's true for every activity that I'm going to show you. I just want you to know that those are the resources that you have at your fingertips if you need them. Okay. So going back to the original deck, the next activity is prehistoric contest. Now, this one's really simple to go through. And if you think about what it's indicated for, we are asking a patient to consider themselves as like a spear, okay, some kind of javelin. And what the patient's job is to do is inhale to cock that javelin back, and then maximize blow air out to launch it, okay? So when you think about what are we working on here? Well, we're working on getting air out, especially fast in that first second, what RTs might call the FEV1, like how much air you get out in 1 second is what we're trying to work on here. So when you think about who's indicated for this, well, this is your patients with COPD, right? Asthma, bronchitis, bronchiectasis, those types of things. People who have a tendency or bias towards hyperinflation, neurological disorders, dysphagia, dysarthria. There's so many indications for just this, where prehistoric contest might be better than something, say, than Diamond Mine. Okay, so it's kind of neat that Flow gives you the opportunity to pick customized exercises for your patient based on their condition, and then parameters that you can adjust as a next step. I just love that about this tool. Okay, so again, just to show you for prehistoric contest, the idea is to tell a patient to take a breath and exhale as hard and as fast as they can. This is the slide that I was on explaining who this might benefit and what impairments you might be up to. That's what we where we left off rather. So these are people with reduced expiratory muscle strength, or with conditions where expiratory flow is just not going the way you want it to. Speech therapy out there, big indication for your neck of the woods, especially for phonation, intelligibility, timing between breathing and eating. All of these things come to mind. But also patients with COPD who have difficulty clearing their airway. this might be a great benefit for them. Some of you might have taken other classes with me or seen the pulmonary essentials class, but with that spirometer, you'll notice that it's split in mLs. And right here, about 1,500, if your patient can't generate at least 1,500 mLs for the incentive spirometer use, they probably cannot clear their airway. So if you have somebody in that boat, definitely think about using prehistoric contest with them. So lots of ideas for why you might want to use this, but the overall goal is to improve that expiratory muscle power, especially that first second or two. So very simple. What I'm going to do now is get out of this and go back to my flow demo. And you'll notice that the main 5 exercises are shown here. We're moving over to prehistoric contest. Again, easy, moderate, hard. Presets are all there for you. And what we're hoping is that you've done an assessment with Flow to figure out what volume is appropriate. So, because what we're trying to show now is how do you actually do prehistoric contest and adjust the parameters. And again, you can do the presets if you need to, but customizing is what I'm looking for here. And you'll notice nowhere near as involved as it was with Diamond Mine, because there's not a whole lot to it. The biggest thing is how many sets, right? How many reps and what time between the reps. Again, just like the last activity, if you want to make that stuff harder, do more sets, do more reps, or decrease the amount of time between sets. But the flow is what it's all about here. Okay. So the harder that, the higher you bring that. And again, for me, I'm going to need something more in that category of 20 or more. You may very well be working with patients in the 1 to 4 range. So it's very important that we get that one right. I'm going to hit confirm. I'm going to start the exercise, prep my sensor, and you'll hear that little buzzing sometimes when you're using this right next to your ear. And as the exercise queues up, again, because this is more an exhale type thing, I would very much want you to consider having a collection, vessel near, towels, that kind of stuff, because it can get kind of nasty, in between successful sets for clearing airway. Okay, now to do this task, again, I'm going to inhale first and blast the air out. And you would really want to encourage your patient to do exactly that for this activity. So here we go. And you can hear that effort. And even doing that without lung involvement, I still feel the cilia bringing up some secretions. I get that cue that I even want to swallow. So imagine what it's like from your patient's point of view. Now, that was just the first rep. What if you saw a rep like this, where it looked like where I didn't quite go as far as the last one? That would tell me that maybe the volume I selected isn't appropriate. So hitting, especially if I told you that my rate of perceived exertion was high for that, maybe like an 8 or 9, that would tell me, all right, I should go back to parameters and take that volume down. Instead of level 20, let's go maybe to level 13 or so and continue with that so that the patient has more success with it. Okay, so not a whole lot to prehistoric contest. Let me go back to my presentation now. I'm going to do a new share, just in case I'm having problems on that end again. And let me turn my video on. There we go. And we'll go back to the PowerPoint so you guys can kind of follow along with me there. And notice that, again, for prehistoric contest, we went through the indications. We went through the basic one-step command. If you needed a review of the parameter manipulation, it's all right there for you, including that light blue color for decreasing challenge and that green color for increasing challenge. And remember, you had that really nice document that I referenced for Diamond Mine. Same one exists for prehistoric contest if you need it. Okay. Final thought there, you're really working on FEV1. Not that you have to utilize that in your documentation, but we always want that to be in the back of your mind when you're working with this particular activity. Now I'm going to jump for a second. The slide's a little out of order for how I want to present this. I want to take you to the next exhale activity, which is sail away. So I'm going to skip through a couple of slides here. So for sail away, what I want you to think of is the same type of patient condition, patients who are having difficulty getting air out, right? But this time, instead of blasting air out for like that FEV1 approach, think about patients with COPD who hyperinflate with any activity you ask them to do. They'll usually adapt a posture of tripoding and they'll purse lip breathe. We don't often have to even cue it. When a patient's really stressed that has bad COPD, you will see them naturally lean forward, tripod, try to get any advantage to use secondary breathing muscles, and they will purse those lips and try to breathe out over time. Well, what are they doing there? If they were to just open their mouth and just let air out, it doesn't give a long enough interval to really help them reduce the amount of trapped air in their lung. And this is more CO2 driven than O2, believe it or not. So what we want to do with patients with COPD, particularly when they've been stressed with us from activity that we chose, is increase the amount of time they can spend breathing out. The more you can increase that interval, the better your patient's going to be. So enter sail away. Sail away is an amazing activity where the patient visualizes themselves on the left-hand side of their screen. This time as a cloud, and they're going to be blowing on the sail of a boat to try to speed it over water. Really clever. So it's like a virtual adaptation of pursed lip breathing. And you see all the indications here, kind of went through a lot of those, but the big thing again here, expiratory muscle strength for all the reasons we talked about before and just recently. How do you do this? Well, a couple of tips. Please make sure that, again, before that the heart rate doesn't scare you. It might decrease with controlled expiration, but then normalize afterwards. And you could actually fail at this activity in two ways. If you breathe too hard, overdoing the volume that we ask you to do, you'll break the boat. You'll literally break the sail. And the second thing is if the volume is too high and the patient doesn't bring out long enough, they won't get to their landing, their destination. So that's what I want you to keep an eye on as we actually switch over to the VR and start playing with this activity. So I'm going to go back to the main treatment selection screen, and you'll notice that sail away is right over there. So I'm going to select that. And just like anything else, you have a variety of presets. Go ahead and use those if you're not really sure how to get started with this. But definitely consider that target volume, though. You can see the volume of 5, 10, and 13. That's a big one. And then all of this expiratory flow stuff, we're going to talk about in the customized parameters section. So notice that sets, reps, time between reps, I believe that would be kind of self-explanatory for you at this point. Much like the volume too, right? So again, if you think about my lungs, volume 5 is not a high enough volume. I'm going to need to move that over to something more like, 10, 20, 21 to be a good challenge for me. But what's this maximum expiratory flow all about? Well, this is what we're talking about with breaking the sail, much like when we looked at stalactites and stalagmites, if I'm doing this right, you want those set so that the patient is doing a nice, slow and steady approach to inhale. Well, sail away is the exact same thing, but in reverse. So you can go after maximum expiratory flow to make sure that your patient is getting the maximal cadence within the volume that you selected. So let me show you what I mean. I'm going to go ahead, hit confirm. We're going to start and prepare the sensor. And again, please be ready for secretions and all that kind of stuff. Be mindful of that. This is a good opportunity to listen to lung sounds if you have to, check vitals beforehand. These couple of seconds, I want you, anytime that OmniFlow screen pops up, just think, okay, prep. Do I have everything that I need? And is everything set the way it needs to be, including this device? So again, I love the carryover here. The patient is typically visualizing themselves as something to the left-hand side of the screen. And notice that if I move over a little bit, there is a meter at the bottom. And watch what happens if I just blast air out any old way. It stopped me. It's saying, hey, you exhaled way too hard. You broke the sail. That's the first way that you can be unsuccessful with this activity. The goal isn't to blast that air out. We want it to come out in a steady and controlled way. So you'll notice if I do this right, that gauge, it's going to be hitting about halfway to push the boat across the water. So let me show you what that looks like. See, I did it. And that volume was appropriate for me. See that nice little checkered flag, and it gives you a countdown. You can change that countdown if needed to challenge your patient more, but that looked like a good one for me, so I'm going to go ahead with another set. And see, I went too hard again, so you would have to educate me. Anthony, you went too hard. Give me about maybe half of what you did there for this next one. And then let me show you what happens if you do the second violation for this activity. You'll notice that I didn't exhale long enough. It wasn't too forceful, but I didn't accommodate that volume that I asked the activity to do, okay? So hopefully this is making more sense now, where if I go back, and again, wonderful data here, and I always forget to point out, don't be afraid to look at the awesome data on the left-hand side of your screen. You can see what my outcome, what my reps were, the outcomes for each rep, what those loops look like. And you might, first effort was way strong, and that's why that sale broke. The second one wasn't strong enough. You can actually graphically see, I hope I can get that a little closer. That's a little blurry. Sorry about that. How I was or wasn't doing with the activity. And what I like about that too, is you can select comments, and you can write in anything of concern, like, verbal cues, 100%, 50% manual cues, or whatever you want to throw in there. And that's all stored. And one of the best things is, as long as you're creating a patient account and you're logging in every time, you're going to be able to see this data for every session and every activity. It's just a gold mine for objective data, which I really, really like about this. And I hope you do too. And finally, the parameter section, if you needed a quick review of what the parameters were for that section, it's right there. So again, with that in mind, I'm going to go to edit parameters, and here's that maximum expiratory threshold. The higher I go, the less, the lower I go, the less likely I am to break the sale, and vice versa. So just want you guys to be aware of that as a general review. Let me go back now. There we go to that treatment screen. And now we're going to go back to the slide deck again. So I will do a new share. Go and let's get to Starry Road. So actually doing pretty good on time here. Okay, so Starry Road. So this is another activity that once you get comfortable with the device, you might find yourself using it all the time. Just to give you a quick, for instance, of what I'm noticing is working for my own patient care and the care that I assist with others. I find like Diamond Mind or that prehistoric contest, I like picking one of those as a primer. Like, let's just do a quick set of 1 of 5 breaths or 2 sets of 5 breaths to kind of prep the patient, get them ready for all those reasons we alluded to earlier, and then have them do the activity I want them to do. And a really nice way to kind of finalize things is to finish up your treatment is to go to Starry Road. And what's Starry Road? In a nutshell, it's pace breathing. As you see here, there's a multitude of patient conditions you can use it for. I would go so far as saying you could probably use it for every patient on your caseload, but specifically people who have difficulty with that in-out ratio. And it's normally around a 1 to 2. The quick, easy button on this is any time that you can generate for inhale, you would want to double on the exhale. So you can see that depicted here, like what impairments might this might be for. Very speech friendly, by the way, with focal intensity, speech intelligibility, impaired respiratory swallow cycling. These are all things of why you might want to use Starry Road specifically. That goal, though, bottom line, is to focus on rhythmical, inspiratory, and expiratory breathing, which a lot of patients struggle with, particularly after you've challenged them. So general tips too, this is to help you understand the parameters that I'm going to take you through. So things like height is determined by the preset volume and slope is determined by the preset duration. I think it's going to make more sense to you after you see the activity, okay? And some of the other bullet points reference what I already said for you. So I'll stop my share. We'll go back over to OmniFlow and we'll select Starry Road. There we go. And like anything, you'll see that there is the easy, moderate, hard presets. So if those are appropriate for your patient, please have at it. But again, what we're really going to be focusing on is that customize. Okay, so let me go ahead and select that. Okay, and I'll move this up a little bit closer so it's not as blurry. All right, and again, very easy to follow along at this point. Number of sets, number of reps, the target volume, all that stuff should be easier to understand at this point based on all the other activities you saw. But again, I'm going to slide that target volume upwards at 20 plus for me, because that's what my lungs need for a challenge, so I can give you a better demo. But then notice that inspiration duration and expiration duration. It's preset at a 1.5 and 2 interval based on what we talked about before. Typically, it's a 1 to 2 ratio for inhale to exhale. If you need to modify that, you can. And for somebody like me, I would probably be starting around a 3-second inhale and maxing this out at about a 6-second exhale. So that's why I want to set it there so you can get an idea of what's going on. I'll show you the activity and I'll come back to the final parameters. So I'm going to go start exercise. I'm going to prep my sensor. Again, I'm making sure my patient's posture is good. I'm explaining them what to expect. All kinds of things that you can do preparatory as this machine cues the activity up. Okay, and so there's the patient as an avatar with an umbrella. Let me move this back a little bit more. And now again, the objective is to breathe and stay within that starry road path. And it's set where an exhale lets the avatar go down and then go up. So this is what it would look like. And you'll notice that was about 6 seconds, which is what I set the device to for breathing out. I missed the inhale a little bit, so I'm going to start that and start the exhale again. So I think that was long enough to give you some ideas. Really quick though, what I love about this activity is notice the parameter button at the top of the screen. If you find immediately like, oh no, the ratio that I guessed of 3 seconds in to 6 seconds out isn't good enough for Anthony, what he's doing right now, hit parameters and you'll notice that you can adjust them during the activity. I know that might be a little hard to see. Let me see if I can get this where it's a little bit easier on your eyes. Target volume, inspiration, duration, expiration, even the pause between each set. You can toggle that during the activity and then hit parameters again and make it go away. So I really like that. That might even be something we should work in for every activity, in my opinion. But that being said, let's go back for a second. Didn't have any data to show because I didn't do it long enough. Sorry about that. I'm going to go back and I'm going to go back to edit parameters because now maybe some of this stuff will make a little bit more sense. For instance, as I was exhaling out, you'll notice that the avatar was going down as I breathe out. Well, not everybody likes that. I have found there are a number of patients that want the opposite. They want when they inhale for the patient to go down and exhale for the patient to go up or vice versa. So what I'm trying to tell you is you have the option of changing that by having the patient where did I put it? There we go. Okay. So you can change that where on the very bottom here, exhalation is up and inhalation is down. If somebody's complaining at you, just hit that guy and it'll change it around. Okay. The path width is another way of making it more difficult to keep them not just within the flow and the timing that you want, but within the accuracy. So you can think of this as kind of like those stalactites, stalagmites, those kinds of things. I'm going to show you what it looks like where I maximize the difficulty there. And you might want to focus on exhale only. Maybe that's maybe you're working with a patient with COPD. You did some prehistoric contest. You did sail away. And now you want to add to that as a final activity with Starry Road. So I set that as so. I'm going to hit start exercise. And I'm just going to remind the patient that they're going to breathe in. And for the activity, they're going to just focus on the breath out. So they don't have to breathe in against the device is what I'm saying. And it's kind of a clever way that this is set up. I just wanted to get you guys to see that. Notice that it's just for the exhale, you're not going to see the upward star slope. Here's how it would go. So that was about 6 seconds right there. And the device is naturally taking the avatar back up. Once I feel ready, I can continue with just the exhale. And you'll notice the path is a lot skinnier, which makes it harder to stick with. That was another parameter that I adjusted in the last screen. Okay. So going back, lots of data that if you actually finished, I apologize, I'm kind of moving along pretty quickly here, but you'll see data on all of these activities just as before. It stores your parameters and you can write in comments as needed. So moving back, the final one is just the dandelion. So let me switch back to sharing my screen, and I'm going to pull up. I think I'm already in there for the so for the slide deck, and let me bring you guys through dandelion. And I apologize to you guys. I'm not doing a good enough job reviewing the slides with you for the parameters. Just as a reminder, for Starry Road, if you need that review of everything I just pointed out, it's all right here for you, both in the slide deck and then also in those nice 1-page, 2-page collaterals that I referenced. Okay, so that's all there if you need it. So let's finish up now with the last activity, which is the dandelion. And the dandelion is a really clever way of helping the patient clear their airway. Now, if you took any of our pulmonary essentials series, you may have come across the active cycle of breathing technique. And the active cycle of breathing technique has been found, particularly in the geriatric community, to be an effective way of clearing the airway, particularly the upper and middle airway. So if you have a patient with bronchitis and you know that sputum and secretions are part of what they're going through, and you ask the patient to maybe do a huff cough and it's not really working the way you want, this might be a great activity to go into. And to be honest, I have one therapist who showed me she likes to use this as a piggyback on prehistoric contest, because whereas prehistoric contest, you're launching the javelin, you can think of dandelion where it's kind of similar when you exhale to launch the dandelion seeds. So active cycle of breathing, a very brief review. It's a very loose approach of 3 steps. The first step is give me a diaphragmatic breath, just a paced rhythm breathing, right, to calm them. The second one is think about lateral expansion. So they're not just breathing from an AP point of view, but also like a medial lateral. Okay. And then the third one is let's lock some air behind secretions and cough them up. That's the idea. Like that's what we're trying to do with this task. Okay. So I think what might be easier to do is show you the activity first and then reference some of these parameters. Okay. But before I do it too, I always forget to go through the indications. Really great slide here that shows how this combines breathing control, lateral expansion, and huff technique. Like I mentioned, this is definitely indicated for patients with post-bacterial pneumonia or post-viral. A lot of patients with COVID, even long haul, will have a need for this type of activity. CHF, again, general core stability. It is a long list, and the impairment primarily is inadequate airway clearance. That's what we're trying to help them with. And check vitals before and after, because I've seen some patients hovering in the high 80s where they do a successful airway clearance and they're in the low 90s for saturation. Really, really cool. So let's show you the activity. I'm going to stop my share. Go back to dandelion. This is our final one. So we're actually doing pretty good on time here, guys. I was worried I was going to go way over. So it's kind of nice that we're getting through it. Let me take a look, back this up for you a little bit. And again, your presets are all set there for you. They might not make the most sense to you right now. So let me take you to the customized parameters first. And notice there's not a whole lot to choose from here. Okay, it's a pretty simple activity. You'll see what I mean, but you can change the reps. And you can decide if you want there to be an inspiratory hold or not. So I will show you what that means. I always recommend to not start with that first, but to definitely work your way into including it. And you'll see why that is. I'll try to explain that to you. But similarly with the minimum expiratory flow threshold, can be manipulated as needed to help your patient get a more successful huff experience to clear those seeds from the dandelion. So let me show it to you, and then we'll come back. Okay, we're going to start the exercise. We're going to prepare our sensor. I'm getting that little collection cup, right? I'm making sure I have all the tools that I need and that the patient is postured the way I would want them to be. And I'll back this up so you can see the whole screen. There we go. All right, and you'll notice, I might have to go over just a little bit more. There we go. So what you'll notice here is you have this nice dandelion, and it's outlining for you the very first step is let's just do diaphragmatic breathing essentially together, right? It wants you to breathe in and out. If you want to, you can have your patient place a hand on their belly, or if you want to manually put one hand on their upper chest, one hand on their belly. If it is indicated, diaphragmatic breathing isn't always indicated. This is assuming it is. Have your patient breathe with expanding that belly. So this is what it would look like. And notice how as the dandelion sways left and right. So again, you should see some similar carryover to that of Starry Road if you did it with them, in that it should be about, 1 to 3 second inhale, 2 to 6 second exhale, and you're going to see this nice left and right, and hopefully a good belly breath for step 1. You do not have to do this for any set amount of time. It's just recommended for maybe 10 or 20 seconds, and then move on to the second stage, which you can see in the lower right of the screen. I'm going to hit start thoracic expansion. And the goal here now is to just take that same deep breath and try to encourage that lateral expansion from that bucket handle movement of the external intercostals, right? To show the patient it's not just AP expansion, but also ML expansion that we're looking for here. And if they even want to flirt with holding their breath for a couple of seconds and then letting it out, that's a great way of locking air behind secretions to help them force air out with the third step. And it's also a great way to maximize perfusion for areas of alveoli that might be collapsed or just not working the way we want. It can force better ventilation as well as respiration. Okay, so how does this work? I'm going to take a breath in, and just like before, I might put my hands on the patient's rib cage or have them place their free hand there and just see if they can belly breathe with that. So it would look like so. Now I chose to do a 2 to 3 second inhale there. You don't have to do that, but same thing. Maybe try 1 rep of that, maybe try 2 or 3. It's all what you and your patient feel is needed. You can even go back if you wanted to the diaphragmatic breath, if you feel your patient needs that, or you can move right into the huff technique. So again, we're going to assume I did a couple of breaths, moving that dandelion left and right, trying to focus on my rib cage expanding laterally. And now I'm ready to do the huff technique, or blowing the dandelion seeds across the field so that I can clear my airway. So you'll notice that it says, please take a breath in to fill your lungs. Now, I do not have the inspiratory hold selected for this activity. So notice that all I have to do is make sure that I'm using the flow meter underneath the dandelion. So this is how it looks. And at this point, your patient may need to cough to clear their airway. If they do, you can track it. You can, in the bottom right, you can hit coughed and show that, hey, we were successful. Maybe 1 cough is all we needed, and now we can move on. That airway is cleared. Maybe it wasn't enough, though. Maybe the patient got some up, but you could still hear that rattling. You're listening with your stethoscope, and you can kind of still hear some abnormal breath sounds. So we start over again. We do our breathing control. We move into our lateral extension, right? And then we set up our huff again. Now notice that flow meter on the bottom. If I don't do a good enough breath, I won't move the dandelion seeds as far. So you can adjust that parameter as needed in the initial setup. So let me take you back there for a final review on this one. And again, all the outcomes per reps, the loops, all of that data is stored, which I just think is brilliant. Going to go back to edit parameters, and hopefully now it makes some sense that the minimum expiratory threshold, like how much pressure do I have to generate minimum before those seeds disperse, that's what you can adjust as needed here. Okay, so have fun with challenging your patient with that. I think it'll be pretty easy to realize how to do that when you actually have it in front of you. But keep in mind that shunting effect, that holding the breath for a couple of seconds before you go after the cough technique, that's what the active cycle of breathing technique is really all about. And you can toggle that by hitting that there and then saying how many seconds you want your patient to hold. So let me show you a final representation of that so I can leave some time for questions. I'm going to hit start, prep my sensor. And what we'll do again is we'll bypass the breathing control. It's just that belly breathing for a couple of reps if you need to with your patient. Thoracic expansion, again, encouraging that lateral expansion. You can always go back to a belly breath if you need to. There are some researchers out in the UK who use this technique successfully by advocating for step 1, step 2, step 1, step 2, step 1, and then step 3 to breathe out. So you can mix and match this as you need, but it can really be as simple, if you wanted to, as going to step 3 and just seeing if they can clear their airway. Okay. So notice here that it's going to say, take a deep breath to fill your lungs and hold it for 2 seconds. And there's a new meter in the middle here. That's because I selected that parameter to include an inspiratory hold. And here's what it looks like. So notice I held for 2 seconds, and then I overcame the minimum expiratory flow that I selected. And those seeds went so far, they even went off the screen. Let's say I coughed. I cleared my airway. We're done with this activity. Okay. Some people don't want to use it for that. You can just use it almost as an FEV1 if you'd like to, much like the prehistoric contest, as I mentioned. So I'll get out of here now, and I'm going to go back to my share. There we go. And just as a kind of final review for you guys, you'll notice that we went through all the indications and what impairments and what the goal is for every activity at this point. Just left off on dandelion here. As we said before, in your slide deck, it'll take you step by step through what I just showed you in a lab format and give a little bit more clarification on what minimum expiratory threshold is for, how to decrease it, how to increase it, and what would happen with that. So please use these references as you need. That's the end of that presentation. And I'll show you again, if I do a new share, just wanted to show you a final reference here of all of the one-page documents, well, technically two, where Diamond Mind is covered, as I already went through. We have prehistoric contests, and again, not a whole lot to keep in mind for decreasing and increasing challenges. We have it for sail away as well. Here's your Starry Road, and I can kind of show you how the decrease, increase challenge chart looks there. And then finally for Dandelion. So really helpful resources. I hope this gives you some new ideas on how to use this device, how to change it when you're in the midst of treating a patient. It can be tough. It can sometimes be messy. I'm not going to lie, but it's a very rewarding experience. And I find that patients with the virtual augment, they'll start challenging themselves even, where before they realize they only got to level 10. Now can I get to a level 11 or 12? Or some patients you might find before you put them on some type of aerobic trainer that they struggled with it and they didn't like it at first. But if you help them clear their airway, maybe with Dandelion, or if you help them do the Diamond Mind for 10 breaths before, it's now easier to handle that aerobic task or even that gait training or ADL that you have planned for them.